Namaste, myself Dr. Diva Gupta from JAYOTI VIDYAPEETH Women's University, Jaipur, Associate Professor in Department of KRIYA SHARIR, Faculty of Ayurveda Science. आज का हमारा सेशन है रेस्पिरेटरी सिस्टम फिजियोलॉजी. Respiration is the process in which oxygen in and CO2 is given out. Respiratory rate is respiratory rate means respiration in 1 minute. In newborn, it is 30 to 60 per minute, and in adults, it is 12 to 16 per minute. Respiratory tract includes upper part and lower part. Upper part has nose, pharynx, and larynx, and lower part has trachea, bronchi, and lungs. Trachea and bronchi combinedly form tracheobronchial tree. Then it is tracheobronchial tree, which includes trachea. Then it divides in right and left bronchus, which is also called primary bronchus. Then primary bronchus divided in secondary bronchus. Left side has 3 bronchus, and right side has 3 bronchus, and left side has 2 bronchus. It is also called lobar bronchus. Then lobar bronchus is divided into segmental bronchi, which is also called tertiary bronchi. Right lung has 10 tertiary bronchi and left lung has 8 tertiary bronchi. Then tertiary bronchi divides into many bronchioles. Then these bronchioles have diameter more than 1 mm, less than 1 mm. Then it is called terminal bronchioles. And when their diameter becomes less than 0.5 mm, it is called respiratory bronchioles. Then it is a diagram showing trachea, bronchioles, lobar bronchioles, segmental bronchus, alveolar duct, alveolar sac, and alveolus. Then it is respiratory unit. Respiratory units contains respiratory bronchioles, alveolar, antrum, alveolar duct. Respiratory unit is a structural and functional unit of lung. Exchange of gases occurs only in this part of the respiratory tract. Types of respiration, 2 types, external and internal. External involves exchange of respiratory gases between lungs and blood. Internal involves exchange of respiratory gases between blood and tissues. Then this is a diagram showing a bronchiole with alveoli, blue lines showing capillaries and many alveoli here. It is a site of external respiration. Phases of respiration: inspiration and expiration. Inspiration, during which air enters the lung from atmosphere, and expiration, during which air leaves the lung. Inspiration is the active process involving contraction of diaphragm and external intercostal muscles. Expiration is the passive process involving elastic recoiling of lungs and thoracic cage. There are muscles of respiration, 2 types of muscles, primary and accessory. Primary muscles involved in normal quiet respiration, and accessory muscles involved in forced respiration. Inspiratory primary muscles are diaphragm, external intercostal muscles, and accessory inspiratory muscles are sternocleidomastoid, serratus anterior, levator scaleni, and pectoralis muscle. Expiratory muscles are primary, internal intercostal, and accessory is abdominal muscle. Then there's a diagram showing different muscles involving in respiration. Movements of thoracic cage. Inspiration causes enlargement of thoracic cage, increase in anteroposterior and transverse diameter due to elevation of ribs, and increase in vertical diameter due to diaphragm. Contraction of scaleni muscles causes first rib move upwards, which increases anteroposterior diameter. Movements of second to sixth ribs causes increase in anteroposterior and transverse diameter. Contraction of external intercostal muscles causes elevation of ribs, upward and forward movement of sternum. It is also called pump handle movement. In this movement, anterior-posterior diameter increases, and arches of these ribs move upward and outward, which is also called bucket handle movement. In this, transfer diameter increases. Movement of 7th to 10th ribs increases transverse diameter. There is a diagram showing pump handle movement and bucket handle movement. Increase in vertical diameter by the descent of diaphragm. Normally, diaphragm has dome shape with convexity facing upwards. During inspiration, central part round downwards, so the diaphragm is flattened and vertical diameter increases. Movements of lungs. During expiration, thoracic cavity decreases in size and it reaches to pre-inspiratory level. Pressure comes back to pre-inspiratory level and it compresses lung and air is expelled. There is a tendency of lungs to collapse because elastic property of lung tissue or recoiling tendency and surface tension that is excreted by fluid secreted from alveolar epithelium. But there are some factors which prevent collapsing of lungs. These are intrapleural pressure and surfactant. Surfactant decreases surface tension. Surfactant is a lipoprotein complex which is secreted by pneumocytes and Clara cells. Pneumocytes are a type of alveolar epithelial cells and Clara cells are situated in bronchioles. Clara cells are also called bronchiole exocrine cells. Then respiratory pressures. In respiratory system, there are two types of pressure. First, intrapleural or intrathoracic, and second, intraalveolar and intrapulmonary. Intrapleural pressure, pressure in intrapleural cavity. Pleural cavity is between the parietal pleura and visceral pleura, which is filled with pleural fluid. It is always expressed in relation to atmospheric pressure, which is 760 mmHg. Physiologically, it is always negative. At the end of inspiration, minus 6 mmHg, and at the end of expiration, it is minus 2 mmHg. Pleural fluid is constantly pumped into the lymphatic vessels. It creates negative pressure in pleural cavity. Intrapleural pressure is always remains lower than intraalveolar pressure. It prevents collapsing of lungs. Negative pressure acts as respiratory pump for venous return. So the blood from lower part of the body reach to the heart. Intraalveolar pressure. Pressure exists in alveoli of lungs. Normally, it is equal to atmospheric pressure. During normal inspiration, it is minus 1 mmHg, and during normal expiration, it is plus 1 mmHg. It helps in flow of air in and out of alveoli. It helps in exchange of gases between alveolar air and blood. Then next topic is compliance. Compliance means expansibility of lung and thorax, means increase in volume and pressure of lung and thorax. There are two types of compliance, static and dynamic. Static compliance means it is measured during static conditions, means measurement of pressure and volume of lung and thorax. Then dynamic compliance, it is measured during dynamic condition, means during breathing. Then there are some questions. Reference books. Thank you.